I am Melissa from Bachelor of Science in Nursing of Lyceum of the Philippines, St. Cabrini, and I'm here to impart to you some of my knowledge about filariasis. What then is filariasis? As you can see, filariasis is a parasitic and infectious tropical disease wherein it is caused by filarial nematodes that is also known as filariae. There are 9 known filarial nematodes that use human beings as their definitive host. They are divided into 3 groups, namely the lymphatic filariasis. Under this is the Wuchereria bancrofti, Brugia malayi, and Brugia timori. The worms here occupy the lymphatic system, including the lymph nodes. Next is the subcutaneous filariasis. Under this is the Onchocerca volvulus, Manzanella streptocerca, Dracunculus medinensis, and Loa loa. The worms here occupy the subcutaneous part of the skin or the fat layer. Last is the serous cavity filariasis. Under this is the Manzanella perstan and Manzanella ozardi. The worms here occupy the serous cavity of the abdomen. So these are the 3 divisions of the filarial nematodes that infects and use human as their definitive host. But we will more focus here in the lymphatic filariasis because it is more common in the Philippines. Filariasis afflicts Filipino living in an endemic area. Disease often progresses to become chronic, debilitating, and disfiguring, since its symptoms are often unnoticed and unfamiliar to health workers. The social stigma, especially among women, keeps the disease hidden and undiagnosed within families in the inaccessible communities. Filariasis is endemic into 45 out of 78 provinces in the Philippines. The highest prevalence is in Region 5, 8, 2, and Caraga. That's why it should not be ignored. The mode of transmission of filariasis is through insect bites. More commonly, female infected mosquitoes, and primarily this one, the Aedes poecilius, that bites at night. So now let me show you some pictures that will make you more understand the process of filariasis. To start with the lymphatic system, this one. All the blue lines you're seeing is part of lymphatic system that are possible to be infected by lymphatic filariasis. Next is the cycle of lymphatic filariasis. First, an infected mosquito will deposit larvae on the skin. While biting, the larvae entered the wound. Then, the larvae migrate to the lymphatic system where they grow, mate, and form nest, resulting to swelling and fever. So, it's already an adult worm. Next, a female worm produces microscopic worms called microfilariae, wherein it swims at night in the blood when the mosquito is biting. Next is a mosquito bites an infected person and ingests the microfilariae along with the blood. Then again, microfilariae develop into larvae over a period of a week. Then again, it goes like that. Process, process, process. Cycle, paulit-ulit. So you saw the outside look of the process. Then, next is the inside look. This is the lymph nodes. This is the vessel. And this is the skin. So, when mosquito bites, it leaves the larvae. Microfilariae migrates in the lymph capillary to the lymph vessels. Microfilariae grows and grows until it became an adult worm. It causes the vessels to dilate or to expand and causes the lymph node to expand either, causing swelling and having big extremities. Lymphatic filariasis is more common in the lower part of the body or lower extremities of the body. Later on, I'll show you some pictures of the sick person with this kind of disease. The incubation period of filariasis is from the entry of infective larvae to the development of clinical manifestation. It ranges from 8 to 16 months. So, to start with the asymptomatic stage, wherein the microfilariae is in the blood, that usually that flows at night. It has no clinical signs and symptoms. Some are asymptomatic for years and some for a lifetime. Some progress to acute and chronic stage. Men have higher filariae rates than female do. So next is the acute stage. This starts when the manifestations is already there, like the lymphadenitis or the inflammation of the lymph nodes. Lymphangitis, inflammation of the lymph vessel. In some cases, male genitalia are infected. Next is the chronic stage. It is 10 to 15 years from onset of the first attack. Immigrants are more susceptible of having filariasis than those who live in an endemic area. Chronic signs and symptoms. Hydrocoil. This is the swelling of the scrotum. Lymphedema. This is a temporary swelling of the upper and lower extremities. Elephantiasis. This is the enlargement and thickening of the upper and lower extremities skin. So, as I promised, I'm going to show you some pictures of those people who are infected with filariasis or in the chronic stage, elephantiasis. Look at this. This is the legs, scrotum, and the breast. This is for real. No camera tricks or whatsoever. It's invaded by worms. So, I think you should be aware. This is the picture of the worm. And the worm. And the worm. This is caused by loa loa. part of subcutaneous filariasis. That's it. So how to diagnose a patient suffering from filariasis? First, you will do the physical examination. Then the history taking. If the patient lives in an endemic area or like that. Then observation of signs and symptoms that we discussed a while ago. Also by knowing the lab results. Through lab tests like nocturnal blood examination, wherein we draw blood from the patient at night because it is when the filariae are flowing in the blood. Immunochromatographic test. It is an antigen test wherein it can be drawn in the morning or can be done in daytime. How would you treat filariasis? It is through albendazole, a broad-spectrum antihelmintic drug for worms, of course, combined with ivermectin. Yon. How could you prevent and control? Of course, by eliminating those infected mosquitoes and also with the mosquitoes per se. Environmental sanitation is the most effective way. Clean and green. How would you protect yourself and your family if you're a part of endemic area? First, you can use kulambo or the mosquito nets. Next, you can use long sleeves, long pants, socks to avoid mosquito bites. You can also have insect repellent screens in your houses. And of course, you should know something about this disease so that you can be able to prevent yourself from having this kind of sickness. Always remember that prevention is better than cure. So once again, I'm Melissa. Thank you for watching. Bye and take care.